She was diagnosed of Wilms tumor, and that was January 2018. In fact, initially we were admitted at FMC Oauthc. So from there, we were referred to here. So getting here, Dr. Adefenti attended to us. He explained everything, that is a tumor, a cancer that can kill. So, but he tried his best, telling us all the necessary things we need to do, and we complied. We spent some months here before the surgery.
Like for the first time, the way it starts.
When it first started, the two sides of the neck were swollen. We didn't know how it started, but when we took him to the hospital, because I'm from Warri, when we took him to the general hospital, we were given antibiotics, but there was no improvement. 3 months after I started, there was no money, so we took him to my husband's uncle, who referred us to his company's hospital, but there was nothing still. 3 months after I started again, he started bleeding from the nose, so he could not breathe through the nose because of the swelling. We took him back to the hospital, where they said they would carry out the second biopsy. I told them to refer us to the teaching hospital because they admitted us the first time and they didn't see anything. They persuaded us to stay, that they knew what to do. So when they did the second biopsy, they confirmed Hodgkin's lymphoma. I then asked the doctor what Hodgkin lymphoma was. He said it was a kind of cancer that children have these days. I asked if children also have cancer. He said yes. He then referred us to teaching hospital, that they would not be able to handle the situation again. I told him not to worry, but to refer us to Oauthc. Someone already told me about Oauthc before, so we brought him here. When we got here, the doctor checked through the test results. The results were not complete, so we called them. The doctor said the immunochemistry test, which was supposed to specify the kind of cancer the child had, was not included. We told the doctor to carry out the test. He told us they would have to take the child to the theater again, and since they have the sample in the former hospital, it should be done there. So we sent them some money and the test was conducted. The result was sent down here and treatment commenced. 6 months after, he was declared free. Ever since then, we have been coming for checkup and there has been nothing. He is now free.
What we saw, it was when we got here that we were told she had cancer, but what we saw was that she could not walk. She was walking well before. When she was 12 years plus, she went to school and returned, then complained of leg pain. It was not more than that. It was when we brought her here that we were told it was cancer that got her 2 legs paralyzed. They asked if we could afford her treatment bills and if we were willing to take care of her. We agreed and the treatment commenced. The treatment was called chemo. She took the medication for 6 months. We initially waited for 3 months, after which we were told to come every month for 6 months. We were then taken for maintenance therapy while still on medication and got to control. She was able to walk again. Thereafter, we started coming to clinic till this moment.
Most childhood cancers are curable actually, but it takes a lot of commitment and it drains money, mainly because the drugs we use are very expensive, and we all know that majority of the population in Nigeria, they live below the poverty line. So sourcing for money to take care of cancer patients is quite a big burden on the part of the parents.
We thank God, the miracle worker. When we got here, the doctor confirmed that she had cancer. We had taken her to several places before until we came in contact with Dr. Adefenti, and God used him for us.
The child was diagnosed with cancer and has been on the treatment. Though the child lost an eye to the ailment, the child is getting better now.
And I want to thank God. I also want to thank the doctors, especially Dr. Adifent. He really tried. And here today, the child is doing fine. We have completed the chemo for long. We are only coming for checkup. And no complication, no any issue since that time that we stopped the chemo.
When the case occurred when she was age 3, we never knew it was up to this. We took her to Ondo Hospital. It was there they refer us here. She was giving blood more than 9 times before they sent us to do a test. So there they discovered that she was a cancer patient. They now refer us here. Now, that was around 2013. She was about 3 years old then. So when we got here, we did many tests, like full blood count with film appearance, full film appearance. They now discovered that she was a leukemia patient. She had blast in her bone marrow. We started treatment. Formerly, they placed us on antibiotics treatment. Then when we started the chemotherapy. It was called induction 1. After the induction 1, we started the induction 2. We were about to enter remission before I discovered that I don't have capacity. And I thought she was okay. So I never bring her down here again. We stayed at home. Not quite 9 months, the theory occurred again. Dr. River called us that I should bring her down. I bring her down, he said, nothing we could do than to start afresh because there are a lot of lapses, which he told us that time that we must not stop. Whenever we start this chemo, we should not stop till he will tell us to stop or to be patient at home, not knowingly. Then, to God be the glory, although Dr. Advent turned the chemo to tablets for her. But after the evaluation, they discovered no cancer again. Since 2013, he was declared cancer-free. I think 3 years ago. But we were to be coming every 3 months. Then I exhausted myself. I fell sick, being a single parent. Until now, she's very sound and okay.